My name is Sonali Bose. I'm an adult pulmonologist and specialist in pulmonary and critical care. I work at the Respiratory Institute and the Icahn School of Medicine at Mount Sinai in New York. We study the effects of air pollution on lung health across the life stages, all the way from early childhood all the way up to adulthood. And the research that I presented today looks at the environmental influences during the prenatal period, so in other words, pregnant women, and how that impacts the development of asthma in their children during early childhood. We recruited pregnant women from various hospitals in the Boston area, and we studied their exposure to nitrate pollution over their period of pregnancy. And we then followed the children from these pregnancies up until the age of 6 to see who develops asthma. And we found that being exposed to nitrate air pollution increases children's risk of having asthma in childhood, but particularly for those children who have exposures to high maternal stress during pregnancy, as well as those children who are boys. And so what this tells us is that it's not just the pollution that's important in terms of putting you at risk for developing asthma, but that there are other factors such as exposure to your mother's stress over pregnancy, as well as your own sex, whether you're a girl or a boy, which will help to determine if you're at higher risk for developing asthma as a child. And the way that we've been able to determine this, we've made some novel progresses in these methods. Number one, we've identified the very specific windows of time during pregnancy during which these effects occur. So we found two windows, one at early gestation and one in late gestation, that we think are distinct in the mechanisms of how air pollution might be causing the development of asthma. And secondly, we've used novel statistical methods to try to understand what the interaction is of maternal stress and fetal sex in creating these environments that will then increase children's risk for asthma. One of our major conclusions is that using these methods, we can better identify complex interactions in populations to basically find vulnerable subgroups within a larger population that might be more sensitive to the effects of pollution. Because previously we've been looking at larger groups of mothers and children, and the associations between pollution and health effects have not been as clear. So I think this is one approach to trying to amplify some of those relationships and really understand who is at most risk for the effects of environmental stimuli such as air pollution as well as maternal stress during pregnancy.